the awareness of CCI as an issue started amongst neurosurgeons who usually were treating Chiari malformations, and then they became aware that, hey, I'm seeing a lot of patients with EDS, and then they became aware of the connection between EDS and CCI. So there's a small handful of surgeons are the ones who sort of popularized these measurements and sort of operationally decided, oh, these are the measurements for CCI. So it got into the unusual situation where the only doctors evaluating people for CCI were the surgeons. I say unusual because, you know, most patients with CCI aren't going to need surgery. So, you know, generally the surgeon's role is to do the surgery. Certainly they've got expertise in assessing it. So it's still that way more and more. You know, there's neurologists like myself, there's other physicians who are aware and at least able to ask their neuroradiologists to make these measurements. We have some other ways to try to figure out how significant the CCI is. But if you speak to someone, you know, a couple of these surgeons like Dr. Henderson in Maryland, Dr. Bolognese in New York, who do many of these CCI surgeries in people with hypermobility, they'll tell you that, you know, 25% or less of the patients that they see that they operate on. So in other words, 3/4 or so of the patients that they see and diagnose and believe do have CCI don't feel that surgery is the next step for them. Maybe never, or certainly not at that time without trying more conservative measures. So again, similar to Chiari malformation, the majority of people, even if you have CCI, you're not going to need surgery, and there's going to be other ways that can help. It can be very hard to sort out what symptoms are coming from what. There's a feeling or an idea, an impression that CCI can affect the autonomic nervous system. So people who have POTS and similar conditions, autonomic disorders that have been hard to get under control with other means, maybe that's because the CCI is impairing it. And there's certainly been the anecdotal experience of people having surgery for CCI where basically the back of their skull gets fused to their upper cervical spine, some of the so-called vertebrae bones, to kind of help correct that abnormal tip, that instability. And then their autonomic problems get better, or some of their other symptoms get better. Up until now, or right now, there's no systematic way that I'm aware of that anybody looks at that. In our clinic, we're starting to get an idea of, you know, what effects CCI might have on autonomic issues, on cerebrospinal flow issues, on blood flow issues, on symptoms, on functioning of the neurologic system using what we call neurophysiological tests, where we send electrical stimuli or other stimuli through the brainstem, through the spinal cord, and see if different positions and putting people in traction to help relieve the issues of CCI. But right now, nobody really has good ways of sorting it out. So it does get very difficult, and there are only a small handful of specialists who deal with it. But to reassure you, I'd say the first step is always going to be PT. And whether you have neck issues or not, any sort of joint issues with EDS, with hypermobility, PT is going to be one of the most valuable things.